Hello, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the CE providers teaching massage and bodywork here, including trigger point therapy. Now, hopefully, you're already a licensed massage therapist. Trigger point therapy is part of massage, which is a licensed healthcare practice. So, as a continuing education provider, you would have already completed rudimentary training of precautions, contraindications for massage or hands on soft tissue manipulation. There are many of those, and you need that type of education to build upon it and practice modalities such as trigger point. Today, what I'm going to show you is intra-oral work. And we're going to use something that we call like a pincer technique. You can also call it a pincher technique. It's similar to neuromuscular therapy when you put a soft tissue such as the SCM in between your pointer and thumb and rub together like a money sign. Well, trigger point therapy, we hold sustained pressure, and we're going to do that same type of money sign pincer technique inside the mouth, intraorally. One finger is going to be inside, and the second finger is, well, it's actually going to be your thumb, is going to be outside the mouth. And we're going to find trigger points in like the masseter muscle or buccinator and hold those trigger points. Okay. Now you could apply trigger point therapy externally. And one of the ways you can do that is when you find a trigger point, you can brace the muscle or pin the muscle between either the zygomatic bone or the teeth. But we find intraoral work to relieve trigger points in some of the facial muscles to be really effective. And this is what it looks like. Ready? So we have our client here. I'm going to show you from 3 different views, and keep in mind I'm gloved up and I'm not going to touch the client's head or anything with my thumb or pointer, specifically my pointer, because my pointer is going to be inside his mouth. So you can look at whatever view makes most sense for you. I'm going to stick my pointer in, and then once I find the muscle I want to trigger point, I'm going to hold it and pinch it with my thumb. Now, usually pressure will create a hyper irritable response on a trigger point, and sometimes you might feel pulsating. If it's pulsating and the intensity is getting greater, you're probably on a blood vessel or a nerve or something like that, and you need to relieve pressure immediately. But if that pressure starts to dissipate, it's probably a trigger point. And that's how we would apply trigger point therapy intraorally on an individual muscle. Is we're going to stick our finger into the mouth, hold and pinch that trigger point until it dissipates and relieves. We did that for just a few seconds, but trigger points might take 30 to 60 seconds to relieve. I probably wouldn't do more than 60 seconds of pressure with that intraoral trigger point therapy technique. So we hope you found that useful. If you want to learn more trigger point therapy techniques, we have them in home study classes, live webinars, and live in person in classroom instruction as well. If you purchase any of our home study, it's available to you immediately. 24 hours a day, 7 days a week. After you purchase, you'll get an email, access it, available 24/7 until your course access expires. So we have a lot of trigger point therapy training options available to you. We hope to see you in class. You should take trigger point therapy training to practice trigger point, because there's a lot more than just applying pressure. There's an entire theory of practice and principle behind it, which is what we share in our trigger point therapy classes. So until we see you in a class, we hope that you're all safe.